If you're thinking about grabbing a face mask to avoid the coronavirus, think again. United States Surgeon General Dr. Jerome Adams says they are not effective in preventing the general public from catching it. He also says everyone's rush to grab them is causing a shortage, putting healthcare providers in a bind and communities at risk. Instead, health officials are telling people to get back to the basics, stay safe. Dr. Eric Mizuno from Weiss Hospital joins us this morning. Thank you so much for being here.
Thank you for having me.
All right, a lot of people are concerned about this, of course. The mask thing is one thing, but let's talk about symptoms. Obviously, we have a third person identified here in Illinois. Should there be general concern across the Chicagoland area that you might catch the coronavirus?
I mean, it's out there. It's nowhere near the amount that flu is around. 30 million people in the U.S. have had the flu this season, and less than 100 people in the U.S. have had the coronavirus identified at least. But it's the same thing. It's in the air, and whether you're breathing a coronavirus or flu virus, do you care? You just want to stay away from viruses in general.
That's a good way to put it.
So what are the symptoms? I think so many times all we're hearing about is a respiratory virus. So what are people actually coming down with?
So we, us docs, we use all these fancy terms.
Yeah.
So we say upper respiratory, that's your head and neck, your nose, and there's lower respiratory tract. And so most things up here are what you would call the cold. It doesn't make us concerned.
Yeah.
You have the cold, what's the big deal? If it drops down lower, well, that's your lungs. That's how oxygen gets into your body. This becomes life-threatening. Unfortunately, the current coronavirus actually gets into the lower respiratory tract, and then you can stop breathing, which doesn't really help you live. And so it's a big, big difference between coronavirus and the flu.
So how do you know if you have coronavirus, really?
So you can identify it only by the symptoms. So anybody who has lower respiratory tract symptoms, number one, it's more dangerous. So get it checked out. If you, in addition, have known somebody who was in China or came from an area that might have brought it into your environment, then of course you're more concerned. But these are relatively small numbers currently.
I know two of the biggest concerns are the mortality rate behind coronavirus versus the flu. I believe over 2% is the latest numbers for mortality rate for coronavirus. And also that transferable rate, how much one person transfers it. And I think the current rates are one person transfers it to over to two people. But are these just small sample sizes and we just don't know enough about the virus yet?
You've done your homework.
Yeah.
That's amazing.
Occasionally.
Usually, you have to be Asian to know math, but in your case, you've done your homework.
He said it, I did not, okay.
This is correct. So there's a transmission rate issue. Everything's a guesstimate because we don't know the numbers currently. Currently, they're projecting that out of every person who has coronavirus, they will share their wealth with 2 or 3 other people. That means this expands. You must be below 1. If you're at 1, I have it, tag you're it.
Yeah.
You get rid of it, tag you're it. It'll self-perpetuate. The SARS virus died because it dropped below 1, and at 0.4, what it dropped to, it sort of died out, basically. The real problem with corona is one of the things is we don't know the numbers, because if you haven't been tested, how would I know you have it?
True.
And they've been very specific about who they're going to test in America, at least.
Do we know who's most at risk for it?
So anybody is at risk if you have a nose or mouth. Most of us have this because we breathe in air. But I think maybe the question you're getting at, which is an excellent question. Excellent question. Get to the gist of it. Are who's going to die from it?
Yeah.
And so these right now appear to be the elderly. We always thought that, well, if you're young or old, for some reason kids, they're not affected by it as much, but they don't have great habits. They pick their noses and they share things with all of us. God bless them.
Amy knows.
So they spread it more widely, but thankfully it doesn't seem to affect them as much. But everything is a moving target. We're still learning more about this virus.
So we've heard like don't use the face masks because obviously the medical professionals needed it, and that's not the problem. They're also hearing about hand sanitizer. Does that work, or does it just go back and wash your hands like you're supposed to?
So the general rule of thumb is be polite. So the way it gets into our body, since we breathe it in, is through our nose and mouth once again. So we tend to get it on our hands. We shake hands. Somebody has the same habit. They touch a doorknob. We touch the doorknob, and then we get it on our hands. We have the same thing about being up in this area. So keep your hands below your waist at all times. And just in case, not hands above your waist, not CPD, but hands below the waist. And just in case you might have forgotten, wash your hands frequently with an alcohol-based substance, or wash your hands with warm water and soap.
All right.
As you should be doing anyway.
Yes.
For the flu.
It's a good reminder. Yes, for sure.
All right, thank you so much for being here, Doctor. We
Thank you
really
for having
appreciate
me.
it. To learn more about Weiss Hospital and how to protect yourself from the virus, visit weisshospital.com.